We are here with Dr. Joe Indrieri. Affectionately we call him Joey Knuckles. He's an ex-MMA fighter and still does a lot of mixed martial arts training. But his left upper extremity has sustained a lot of trauma over the years. He's actually left-handed. And through the years, he actually developed an ulnar neuropathy, and that's just a big word for saying that his ulnar nerve was compressed in multiple locations along his upper extremity, particularly at the elbow, also known as the funny bone. That's where the ulnar nerve goes. And then it extends down into the hand and goes through a little tunnel called Guyon's canal. We found out through a pretty extensive nerve conduction study done by one of our good colleagues, Dr. Martinez, that he had compression at the elbow and at the wrist, and it wasn't surprising that he had a lot of scar tissue, a lot of thickened tissue around the nerve that had really constricted it. So we took him to the operating room. He's 5 days status post that operation now. Been doing great. He said that his sensation started to come back. One of the biggest problems that he was having, he developed something called a Wartenberg sign, where the small finger starts to drift away from the other digits because that nerve that goes to those muscles is actually weakened. So now we're starting to see that he's starting to put that finger back together. Dr. Indrieri, why don't you tell us a little bit about how you've been doing after the operation?
Yeah, it's been fantastic. I didn't have any pain. Haven't taken any pain medication. I've not even needed NSAIDs. You know, a little stiff now after being in the dressing, but fingers are moving fine. Elbow is moving fine, and feeling very positive about the outcome where it is right now, but also for the future, given that I already had a Guyon tunnel release that didn't really seem to help, with Dr. Martinez finding the issues at the cubital tunnel. Great to have both areas addressed.
One of the special things about this operation too is generally when you do a cubital tunnel release, there's a long incision that is made here at the elbow. I do it through a minimally invasive approach. I do an endoscopic assisted cubital tunnel release, and you can see that the incision itself, where the steri-strip is stretched, is only about a couple of inches. And it avoids long incisions here, avoids more stitches. It's a faster procedure, it's more efficient, and I think that's one of the benefits of being able to use the hand a lot quicker and with less pain. And then the Guyon's canal, as he mentioned, he had already had an operation done through a different approach. I actually used the traditional approach down the carpal tunnel. I released the carpal tunnel, and then I divided Guyon's canal, or divided the ligament that separates Guyon's canal from the carpal tunnel, and now that's one big tunnel containing both of those nerves. So overall, we're pretty happy. Day 5, and we're just going to be following him very closely for the next few weeks. He'll come back in about a week and a half to get the stitches out in the palm of the hand, and we'll go from there.
You have a lot of doctors who are fantastic doctors, but they're doing really ancient and outdated procedures. And everybody I went to wanted to do an ulnar nerve transposition. Being in medicine myself, I know I've not really seen a whole lot of great outcomes with those. And so finding Dr. Indrieri is kind of a lifesaver for me, because he's the first person I've ever met that was on board with what I wanted, which was not to do an ulnar nerve transposition, but actually go in there and do an arthroscopic release.
When you release the ulnar nerve at the elbow, sometimes you have to move the tissue, the nerve, and bury it in some of the muscle to protect it if it's snapping around the elbow. But that's a test that you can do in the operating room. And when we actually released it, the nerve wasn't snapping. We did an inside to release, and that basically means keeping the nerve in its normal position. And with that, I think we've gotten success so far. We'll see what what happens over the course of the next few months. And I always tell these patients that they're not going to get immediate relief. It may take a few months, 6 months to a year, before we have complete resolution of the symptoms. The nerves heal at about 1 millimeter a day, which is about 1 inch a month, and you can imagine that's a few inches where it's compressed over here, so it could take a few months. So.
And even just in the time that you've taken the dressing off, I'm already able to clinch stronger just in the last 5 minutes that we.
That's awesome.
That we were. So I imagine I'll be able to start hitting that bag again and by tomorrow afternoon.
All right. Well, that's Dr. Indrieri. Thanks for letting us take care of you. I appreciate it.